Let's start by orientating ourselves with the sheep brain. This is the dorsal surface, ventral surface, and this would be the rostral end, and where the cerebellum and spinal cord would be coming out, this is the caudal. The tough white coating on the outer surface of the brain is the dura mater. It completely surrounds the brain, offers protection. It is the outer layer of the meninges. On the ventral surface, you will now see the pituitary gland in the middle, and then to either side are the capillary or capillary beds right there. Okay, so the pituitary and the capillary beds. Okay, this is on number 2 in the instructions. Just want to mention at this point, you can also see quite clearly here the 2 optic nerves coming in, okay, right here and right here, noting that bundles of axons in the peripheral nervous system are called nerves. Once they cross over at what's going to be known as the optic chiasm and enter the CNS, they are now going to be called tracts. So it's optic nerves, optic chiasm, and optic tracts. With scissors, I made a mid-sagittal cut through the dura mater, and now I can remove this to reveal the surface of the brain. Okay, looking at it this way, and now if we go and look at the ventral surface, you'll see that the dura mater is still attached. Okay, unfortunately now, to remove this, if we look at the rostral end here, I'm going to start from here. If you look under this, as I pull this up, you're going to see I'm going to have to cut the optic nerves. So I'm going to go ahead and do that, just cutting those nerves. And now as I continue to pull this up, you will see that there's other nerves that I'm also going to have to cut. Now we're not identifying these, but these are a variety of cranial nerves that I'm having to cut as I pull away the dura mater. So I'm going to continue to do that, and then we will look at the next slide. In step 1, you have to identify a few fissures and lobes. So the mid-sagittal fissure going right down the middle here is called the longitudinal fissure. There's another less defined fissure right here, which is called the cruciate fissure. And then the basic cerebrum is divided into lobes. So we have the frontal lobes, we have the temporal lobes, we have the parietal lobe right here, and then at the back is the occipital lobe. And the way I remember that is F-pot. We have frontal, parietal, occipital, and temporal. Looking back here is the cerebellum. Okay, you can see that it's separated from the cerebrum here. So the cerebellum, although not looking too good here, you can see that there are 2 cerebellar hemispheres, and then in the area in the middle here called the vermis. Okay, further down, you now have, looking at the caudal end of it, you have the medulla oblongata, and this one has been cut short, but had it extended, it would have been the spinal cord. On the ventral surface, this is number 3. Step number 3, you can now see the optic chiasm, which is the X. Coming in here, which we cut earlier, would have been the optic nerve. That is in the peripheral nervous system. Once it crosses the optic chiasm, it now becomes the optic tract. Okay, so nerves in the PNS, tracts in the CNS. The other structure you can clearly see here are these other nerves, which are called the optic bulbs, right there at the rostral end. And what you can't see here, because unfortunately we had to cut it off, but it would go right in there, is the infundibulum, which was connected to the pituitary gland. In step 4, this is the caudal end. Here is the cerebellum, here is the medulla, and as you pull those 2 apart, and I'm not sure if you're going to be able to see it here, you should see a very fine spidery-like substance. There it is right there. You can see it. Okay, that is the arachnoid mater. That is the middle. Also in step 4, you can, as you continue to pull this down, you may or may not see some blackish material right here. Okay, this is what's known as the choroid plexus, and this is what the blood vessels involved in making the cerebral spinal fluid. This right here, underneath the cerebellum, is the 4th ventricle, and this little structure right here where it comes together is called the obex. In step 5, we are looking at the ventral surface of the medulla, and here it is right here. Okay, so a little bit hard to see. I had to remove some of the really tightly adhered pia mater from this in order to see this, but you can now see that there is a sulcus going right down the middle of it. Okay, that is the ventral median sulcus, and then of course the medulla is right here. Up here we have the pons, okay, and I'm not sure if you can see it here, but there's a couple of little bumps running down parallel to that ventral median sulcus, and those are the pyramidal tracts. And what's really not showing up very well right now is there's a structure here, a little bump right below the pons, and that is the trapezoid body. In step 6, we are again at the caudal end. Here's the cerebellum, here's the cerebrum, there is the medulla, and what we are going to do is just bend the cerebellum back and reveal the superior and inferior colliculi. Here is the superior colliculi, and there are the inferior colliculi. And you can see here, again, if you pull it, that there is some of that arachnoid, spidery meninge in there. Okay, so we have superior and inferior colliculi. In step 7, you are identifying the mammillary body. And to find that, just look where the optic chiasm is, and right there would have been, you can see clearly where the hole where the infundibulum would have gone, and right below it, right this little section right there, is the mammillary body. Here we're looking at the mid-sagittal section, and first of all, let's just follow the path that the cerebral spinal fluid would flow. Cerebellum has fallen off there. Okay, so right here we have the lateral ventricle. Okay, in all of these ventricles there's going to be cerebral spinal fluid being produced, and if you were to go in, you might be able to pull out a little of the choroid plexus. I don't think that was it. A little bit, as long as it's got a little bit of brown, which is the blood vessels producing the CSF. So we have the lateral ventricle. It is then going to go through the foramen into the 3rd ventricle, and again you're going to find that choroid plexus in there. The 3rd ventricle is around the thalamus right here. It's then going to go through this little structure here called the cerebral aqueduct, and then go into the 4th ventricle, which will be, as we saw before, underneath the cerebellum. Okay, so once again, lateral ventricle through the foramen into the 3rd ventricle, through the cerebral aqueduct, and then into the 4th ventricle. The other structures that you can see here are the corpus callosum, which join the 2 hemispheres, and the fornix below it. The other structure to note in this section is the structure right here, and that coming up, there's the thalamus, and this right here is the pineal body. Also, you can see here, just at the beginning of the spinal cord here, you see a center, a little canal, okay, right there. If you look at it through this way, there's a little bit better, you can see it, and that is called the central canal. Okay, the other structure right here is I've taken the cerebellum off. Just take that away. So here's the cerebellum, and what you can clearly see is the gray matter and the white matter. And the white matter forms like a tree-like structure, and this is known as the arbor vitae. Okay, if you take the cerebellum and note that all of these little structures are all folds. Okay, these are not really attached, And if you look at them like that, they're all little folds going in to increase surface area. Okay, similar to the cerebellum. I just want to note here, to the cerebrum, is that when you did that sagittal section, you weren't really cutting this. You weren't cutting anything until you got to the corpus callosum. This again was just a fissure, and again it's just a fold, and if you were to start to gently pull apart this, you would see that these were all little fissures and sulci that increases the surface area. The pia mater is holding it all together right now, but these structures are actually not joined. They're folds, as perhaps you can see right there.